CIPA, aka congenital insensitivity to pain with anhidrosis, is the inability to feel pain and temperature with absent to low sweating. This genetic disease affects about 1 in 125 million worldwide. It continues to rise with the population due to the mutation in the NTRK1 gene, or neurotrophic tyrosine kinase receptor, which causes interference that halts the autophosphorylation process that then stops all signals of pain and temperature from being sent to the brain. In other words, it causes a loss of sensory neurons due to apoptosis. This disease goes by names such as neuropathy, congenital sensory with anhidrosis, hereditary sensory and autonomic neuropathy, HSAN4, and HSAN type IV. Its inheritance is autosomal recessive, meaning in the inheritance pattern, both copies of the gene in each cell have mutations. Typically, the parents of one with CIPA, for instance, both carry one copy of the mutated gene, but don't usually show symptoms nor signs making them quote-unquote carriers. The good news is, autosomal recessive disorders aren't usually seen in every generation of an affected family, making it rare. Symptoms vary from person to person, but the main symptoms consist of being unable to feel pain, produce any sweat, and detect temperature. In most circumstances, patients don't live over the age of 25. Signs and symptoms can appear at birth or during early childhood, with severe injuries and unintentional self-injury being repeatedly common. To give some insight, when teething, a baby doesn't feel anything with the disease, so it doesn't know when to stop, unlike normal babies without the condition. Some people with CIPA heal slowly from skin and bone injuries that just lead to, unfortunately, more issues like chronic bone infections, osteomyelitis, or a condition called circuit joints. Due to the absence of sweating, there are the chances of high fevers, hyperexia, and even seizures brought forth by high temperature, febrile seizures. Dental caries, difficulty controlling urine and defecating, behavioral or emotional problems, and intellectual disability are just some of the various symptoms that a patient could show. Going back to inheritance, if two parents both carry the gene for CIPA, in this case let's say big M little m times big M little m, then there is a 25% chance of their offspring showing the traits for the disease and 50% chance or a half chance of their offspring being a quote-unquote carrier. A lot of people with CIPA have thick leathery skin on their palms, misshapen nails, hair loss, and weak muscle tones, etc. Molecular genetic testing, which includes a combination of gene targeting testing and comprehensive genome testing, can be used to detect CIPA. There is no cure for this disease, however, precautions are needed in order to survive. A patient must monitor themselves for cuts, bruises, and other injuries that, since they can't feel, could be life-threatening, forcing them to have to visit their doctors regularly for checkups to make sure there are no internal injuries that could be fatal. Treatment typically is aimed at trying to control body temperature, prevent self-injury, and treat orthopedic problems as soon as possible. CIPA doesn't affect a specific ethnicity or gender, but according to NCBI, Native Arabs are more prone to having this disorder with their environment and high incest rate. A patient by the name of Ashlyn Blocker, who was a 12-year-old in 2012, never cried when she was a baby, even when she was hurt. Her parents and eye doctors were all shocked when she didn't react to dye being put into her eye at just 8 months old when she had a corneal abrasion across her eye. This eye doctor visit, where she showed no signs of pain, was how Ashlyn first became diagnosed with CIPA. Her parents worried due to the fact that there isn't a whole lot known about CIPA and were scared due to the chances of Ashlyn hurting herself and not even knowing it. Nevertheless, Ashlyn still was like any other kid. She joined the band at school and took up the hobby of crocheting, trying her best to try and live her best life without letting her condition ruin it. She has helped contribute to the study of CIPA by researchers studying her in hopes of creating new treatments for people with chronic pain. So far, reports are being made to make physicians familiar with this condition to avoid unnecessary surgeries and amputations, to use conservative treatments, and to simply make the diagnosis of a syndrome easier without extra lab requests. Currently, we can't confirm diagnosis by genetic tests, meaning we have to start treatments by clinical/paraclinical findings to ensure a patient's life is better. To add, there's only about 60 documented cases of CIPA in the US and 300 worldwide out of 2007. Therefore, it's crucial for research to continue to be done to learn more about this disease and the human body.